Alright, so we're getting ready to scrub, and the first thing we're going to do is we're going to grab the sponge and test it to make sure it's still sealed before we get our hands wet. Because it's really hard to open once your hands are soaking wet.
We're going to dispose of the wrapper in the garbage.
And now we're going to use a lot of water. We're going to get the water all over our arms and all over the sponge. You need a lot of water. Alright, that's good. Now we're going to start scrubbing from our fingertips towards our elbows in 3 sections. So the total scrub is about 3 to 5 minutes, probably closer to 5 the first couple times you do it. So he's using the hard part of the brush on his fingertips. And he's going to break his arms into 3 groups. So you're going to have this group here, and then you're going to do this side, and then you're going to do your wrist, and then you're going to do your other wrist, and then you're going to do your lower arm and your elbow, your lower arm. So it's 6 different areas: here, 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 and then here and here, for 5 minutes. And that starts with the area you want to be the most sterile, which is your fingertips, down progressively towards the area that is going to be least sterile, which is your elbows. So you're always thinking, this I want to be most sterile, if that makes any sense, is most sterile, and this elbow is least sterile. So you're always working fingertips towards elbow. So he's onto the second section here, he's onto the wrist. And if he wants to, he can go in and add some more water. He can always get more water if he feels like he doesn't have enough soap. Yep, put some water on the sponge. That's good. You want to keep your fingertips up so that things are dripping down towards your elbow and not dripping towards your fingertips. And as you move down your hand, you can start to use the soft part of the sponge rather than the hard part of the sponge. And then once you're at your elbow, you never want to go back to your fingertips. You stay in those 3 sections. Alright, that looks good. So now he's going to think about how he's going to get the soap off his hands. So he's going to drop the sponge. He's going to rinse the soap off and have the water run from his fingertips down towards his elbows.
Careful not to have his arms touch the inside of the sink on accident.
Trying not to touch anything, which sometimes can be hard.
It is boiling hot.
Excellent. See how he's having the water run off the elbows and not off the fingertips. That's perfect. Now he's going to come to the person who is sterile, who's going to help him get scrubbed. The person's going to hand him a towel, and he will use the towel to dry his hands.
Oh, sorry, Dr. Wallace.
So he's going to dry his hands in the same top to bottom fashion that he scrubbed. He's going to use one part of the towel to dry the whole left arm from fingertips down towards elbows. And then he's going to use a different part of the towel that's still dry and sterile to dry the other hand, again from fingertips down towards the elbow. And he's not going to go back up because the towel is relatively dirty. So now he's ready to get his gown on. So he's going to shake his hands and kind of get them dry, because one of the keys is having dry hands so that you can get your gloves on. So once they're pretty dry, he's going to put the gown on. So he's going to put his arms right into the armholes, put them straight forward, keeping his arms between his shoulders and his waist. And then he just did something that was subtle. He helped himself pull the gown so that it's just, so his knuckles are just where the gown ends, so that he can get the glove on. So this hand is still covered, and he uses this hand to do that. And this is still a sterile situation. So now he's ready to put his gloves on. He's going to start with the right glove. Everybody always starts with the right glove. And he's gonna keep his thumb pointing towards his body. So the person will present you with the glove with the thumb pointing towards your body. Then you go in, down, get some tension. And then if your fingertips are not perfect at this point, you just keep going with the process. You don't fix them yet. Then he'll use his sterile hand to get that hand ready. So again, the gown at the knuckles. And then he's ready to put on his other glove. Again, thumb towards you. And he'll be in. Now is the point where he can adjust his fingertips if they're not perfect. So if 2 fingers are in one finger in the glove, now is the time to adjust it. And then he'll put on his second set of gloves. Again, the right hand first. Thumb towards you. Yep, perfect. He can help himself. Exactly. And now, left hand, but the thumb towards you again. Perfect. And now he can adjust his fingertips if he needs to. He should have been tied while we were doing the gloving, so someone who's not sterile will be doing this. This has to be done before you can spin. So now we get to the hard part for everybody, which is the spinning. The key to spinning is finding your card and your 2 straps. One strap will be short, this strap is short, and the other strap is really, really long. So the key step for spinning is pulling the short strap off the card. So he pulls the short strap off the card, and he hands somebody the card, and now he spins. And he pulls that off the card, and then he ties. Perfect. So once he gets tied, now he's sterile. He wants to keep his hands between his shoulders and his waist. He wants to keep them in front of his body. He shouldn't really cross his arms like this. That's not technically sterile, so he can do something like this. That will keep him sterile. And then you should wait until the patient is prepped and draped in a nice patient way. And then once the patient is prepped and draped, it's probably best to go stand by the patient and put your hands on the patient's legs and just wait for things to develop. And that's a nice sterile position where you can stand for a long time. And I think he did a great job.
All right.
Cool.